Hello, everybody. We're just going to give everyone a few minutes to hop in here and then we'll get started. Okay. Good afternoon, everybody, and thank you for joining the WalkCares team and our guest panel for a webinar on mental and emotional health while aging. For those of you who aren't familiar, WalkCares is the state's new long-term care insurance program for workers. Our WalkCares Conversations webinar series is designed to give you a high-level overview of the topic related to long-term care. Next slide. I am your host, Sam Klawicki. I'm the Communications and Marketing Manager for WalkCares. I'd like to go around to our panel and have each person quickly introduce themselves, starting with Kathy.
Hi, I am Kathy McCall. I am the Advocacy Director for AARP here in Washington State. In Washington State, we have about 900,000 members, and AARP has been very active over more than 10 years in the creation of WalkCares. So thank you for the invitation to this panel discussion.
Thank you. And Mary Pat.
Good morning, everyone. Mary Pat O'Leary. I'm a registered nurse and a senior planner with the Area Agency on Aging for Seattle-King County. We are Aging and Disability Services, and I'm so happy to be able to participate today.
And Tara.
Hello, everyone. My name is Tara Hill Matthews. I'm the Dementia Resource Catalyst at Aging and Long-Term Care of Eastern Washington, here in Spokane. Glad to be here. Thanks.
And Suzette.
Hello, my name is Suzette Tave, and I am the Pearls Counselor with the City of Seattle Aging and Disability, and I provide depression management assistance to King County residents 55 and above that are in need of services. And thank you for allowing me to participate today.
And Sebastian.
Good morning, everyone. My name is Sebastian Kahe. I'm the Outreach and Language Access Lead for the WalkCares Fund. So I'm happy to have everyone here.
So we're going to start with some remarks from our panel members, and then we'll share an overview of the WalkCares Fund. We will also have an opportunity for audience Q&A at the end. You're welcome to go ahead and enter your questions using the Q&A button at the bottom of your screen as they come up for the panel or for the WalkCares team to answer later in the webinar. Today's slides and recording will be posted on our website at walkcaresfund.wa.gov/webinars later today. We are going to start with a quick opening poll, and then I'll pass it to Sebastian for a quick overview of long-term care and caregiving. So as the results are starting to come in, it looks like most people, about 50% of people, said that they're somewhat familiar with mental and emotional health resources for older adults. And then about 50% of people are somewhat familiar with WalkCares as well. Sebastian?
All right. So ourselves in defining long-term care and caregiving. So long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and many, many more activities. It does not include, however, medical care, so things like doctor's visits and treatment for medical conditions. And long-term care covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. And a lot of us don't realize what a broad range of services can be included when we talk about long-term care. So we might think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in our own homes. So in fact, most people with long-term care needs can stay in their own homes with the right types of supports. And it's also very common for family caregivers to not realize that they are, in fact, caregivers. So, for example, you might go to your mom's house for a couple times a week to cook meals, drive her to appointments, and make sure she's taking her medications. And all those, of course, are common care activities. And the majority of this type of care is provided on an informal basis, meaning that it's unpaid care from a family member, a friend, or a neighbor as well.
Great, next slide. Kathy?
Hi, everyone. My name is Kathy McCall. I'm the Advocacy Director for AARP here in Washington State. And again, we have been very active with the development of the WA Cares program. We also are very focused in on supporting family caregivers, and they are truly the backbone of our long-term care system in the state. Today, I wanted to go over and just talk about a lot of resources that AARP has, but also a lot of research that AARP has done related to this topic, related to mental health of older adults, but also how it impacts family caregivers who are oftentimes older adults themselves, whether they are a spouse or a partner, or they're a family member or a friend. They are all part of a system that is helping people age with purpose and dignity. So I wanted to go over the impacts of COVID that we're still seeing, the generational attitudes towards mental health, the prevalence of cognitive decline and dementia, and again, the role of family caregivers. So next slide. So we all know that COVID had a very profound impact on older adults when it came to social isolation. We were all in lockdown. Oftentimes those older adults had very limited networks of contacts and friends, and most of those interactions were in person. AARP has done a lot of research kind of after COVID to look at really the impacts that COVID has had. And what we've seen is nearly 1 in 5 adults ages 50 and over report having experienced long COVID. And why that's important is long COVID, a lot of the symptoms are fatigue, brain fog, loss of taste or smell. So, enjoyment from going out for meals, etc. And also just the brain fog of having challenges, remembering things, remembering to do things, fatigue, oftentimes saying, I'm just too tired to stay connected and get involved. And so the impact of COVID and long COVID still is with us. And we still continue to hear that these are really challenges for older adults. So, and again, the data bears that out. We've seen the major impact on people's physical health, their mental health, and impact on their social life. So we know, that at the core to being, for well-being is to have that social connection and engagement with communities. Next slide. I don't see the slide.
Sorry about that. Yeah, let me pull it back up. It disconnected from me for 1 second.
So again, we also know and have done a lot of research related to generational considerations when it comes to considering the issues around mental health and the health of older adults. We know that there's a lot of generational disconnect related to understanding mental health and also seeking attention. But what is interesting and what I did not include on this slide is additional research AARP has done to show that a lot of older adults, again, these are individuals 65 and older, are using benefits, mostly under Medicare, but some of those individuals who are still on private health care plans prior to Medicare are accessing their mental health benefit. About 60%, 60 or more percent of individuals are using their mental health benefits, which is a good thing. The challenge is a lot of older adults who do not recognize or consider mental health as an issue. We have a lot of older men who consider, mental health as one of those things you just pull yourself up by your bootstraps and you deal with it and you move forward. They oftentimes don't seek assistance or support for those types of interventions and for the care that they actually really need. So that is something that AARP, we continue to focus on. How do we create access and opportunity so that people can have access to mental health supports? And oftentimes those mental health supports, it's really difficult for people to figure out how they can access mental health supports. There's a lot of barriers. People don't understand their insurance, what is covered. Then they need to go out into the marketplace to find a provider and then actually utilize the benefits. So those multiple steps make it often challenging for older adults to access the mental health supports that they need. Next slide.
And sorry, Kathy, I'm gonna reshare real quick just to make sure that the full screen is being shared for the slide. Sorry about that. There we go.
So next slide. So a decline, I'm going to also talk about a decline in cognition. And this is also found in an AARP article from September 2024. Again, all of these resources are available on aarp.org, and a lot of great articles. All of our research is available online for you to dig more deeply into a specific area of concern that you might have for yourself or a family member. So the important thing to know is across all the data and research that AARP has done is one of the things we know for certain is cognitive decline is not an inevitable part of aging. Just because you are aging does not mean that there's going to be an associated level of cognitive decline. We know that, in fact, there is slower mental processing, which can create frustration, depression, and isolation. But we know that the brain is very elastic. There's a term called neuroplasticity, and that we can actually fix those neural pathways by doing certain things like staying active, treating depression, improving high blood pressure and cholesterol, controlling diabetes, limiting alcohol, quitting smoking, and finding social engagement and finding everyday joy. So it's important to stay connected with your primary care physician. Utilize standardized tests. There's the Alzheimer's Association, your medical provider also has access to these tests. Also, be an informed and alert consumer. Check into genetic testing to find out if indeed there is maybe a history related to your genetics of either Alzheimer's or other forms of dementia that can show up in some of the genetic testing. Do your research, know the cost associated with it. But again, keep in mind that cognitive decline is not an inevitable part of aging. There's so many things that can be done to slow down that process. Next slide. So I mentioned the role of family caregivers. So here in Washington State, we have about 820,000 family caregivers that play a vital role when it comes to mental health and well-being of older adults. I am actually a caregiver for my mother, who's 87 years old and who has vascular dementia and Alzheimer's. Alzheimer's is in our family. The vascular dementia is something that we've been able to, with working with her primary care physician, to address through medication. But one of the things that I believe that family caregivers do best and do well is providing connection and companionship for family and family members. I spend a lot of time helping plan, time for her to be with people from her church and with a book club that has been involved in with years. Now she doesn't read anymore, and enjoys reading. She does not enjoy reading, but she still likes to have the fellowship of going to a book club, having snacks, sitting and talking with other people. And the people in the book club, I have told and shared with them, that this is something she finds very satisfying. And so please, help accommodate her. So again, in addition to family caregivers, it's challenging. I think all the tasks that family caregivers do, like meals, grooming, shopping, can be daunting. And it's important to take care of yourself, not only physically, but mentally, emotionally, spiritually, and that you also prioritize your care as a family caregiver, because you cannot be responsive to the needs of your family member if you are not taking care of yourself. And the family caregivers also are advocates with doctors, and signaling when they notice something is different with the family member they're caring for. So again, like with my mother, we realized that she has kind of that seasonal affective disorder where the darkness of being in Washington State makes her she wants to sleep more. She doesn't want to go out. She doesn't want to do the things she wanted. So I talked to her primary care physician again, and we were able to put her on some type of serotonin booster. Now, I'm not a doctor. I'm not a medical professional. What I am saying is talk to your primary care physician, talk to your parent or the person that you're caring for. Make sure that you have the ability to get the information and to provide counsel and guidance and have those conversations with your primary care physician. I am also not an attorney. I am not a financial management professional, but it's also important for you to seek out those professionals and to make sure that your financial management issues are in order with your loved one. Again, there's plenty of free resources available through DSHS, through the Dementia Action Collaborative. I think some others on this panel will talk about that as well, that there's actually free legal assistance for you available to help set up powers of attorney for both healthcare and finances, for helping with end of life instructions. So make sure that you access some of those, because addressing some of those issues are so important, because they can create so much stress and anxiety for a family caregiver, and the person in your care picks up on your stress, or they might be concerned because they have not been able to take care of those financial matters or those legal matters themselves. So again, it's just great to know that there's plenty of services and available. AARP also has a list of all of the documents that you need to have as you think about both your aging and the aging of a family member. So next slide. I guess that was, I forgot that I didn't put an end slide. So again, all the resources are available on aarp.org. You can also go to aarp.org/WA and access information about what AARP and the events that we're hosting here in Washington State. So please, again, make sure you, connect with those resources. And again, all the information, I understand will be shared in these PowerPoints. I've put the names of the articles, and research papers that you can access to read further. Thank you.
Thank you, Kathy. Sebastian, if you could stop sharing your screen, we're going to move to Suzette.
Hello, my name is Suzette Tave, and I am the Pearls Counselor with the City of Seattle. And what I want to discuss is basically what I do as a Pearls Counselor. I assist adults who are struggling with depression and anxiety or symptoms of depression and anxiety. And as a Pearls Counselor, we have recognized that aging does take a major factor into mental health. For example, a lot of our clients are struggling with the loss of independence. Say, for instance, they are seeing that their physical abilities are declining and they're having extreme mobility issues as well. And on top of that, there's medical challenges that they're dealing with. So some are unable to drive, some are unable to care for themselves, and they need extra assistance. And for so long, they've been living independently. This plays a huge factor in them of this sudden change that they're going through mentally. And also then they're also seeing that they're lacking motivation when they're struggling with medical challenges. So our position as Pearls Counselors is we assist them on not basically trying to get an understanding of what's going on and how to reduce those symptoms of depression. What we offer is just an insight on how to cope with these changes and also to have a better quality of life while they can. A lot of clients also dealing with retirement, bereavement, the loss of not just loved ones, but also their lack of independence and the loss of their physical abilities to do things like cooking. And we also see a great deal of individuals struggling with social isolation and loneliness. And as Pearls Counselors, we highly encourage our clients to find ways to socialize, such as participating in book clubs or participating in coffee hour, and also visiting their local senior centers to get more out of the social engagement. And sometimes having people have their neighbors and loved ones come visit them more often than they have been before. But aging definitely plays a huge factor also, and a lot of our clients are very hesitant to seek treatment. And sorry about that. Also, we tell them about treatment, and they're very hesitant on going to the doctor. They feel that as though mental health is something that will pass, that they'll get over it. But we gently remind them that when you're struggling with depression, anxiety, or any other mental health issues, it's just like having a flu. It's just like if you have some joints aching and you need to see the doctor, you need treatment for. So we do those gentle reminders to let them know that this is not something that will pass, but it's something that can be managed. And we also remind them how mental health affects eating habits, sleeping, also their behavior towards others, and how they feel about themselves with the motivation or lack thereof, and their confidence. So aging does play a big factor in mental health because it is a big change from what they are used to. So as a Pearls Counselor, it's more so letting them know of the resources that are available to them, the assistance that we provide for them as a Pearls Counselor, and also exploring what is around them that is there for them to help them reduce those symptoms of depression. Thank you.
Great, thank you so much. Sebastian, if you could reshare your screen,
Yes, I'll go ahead and reshare.
and Jenny.
Hi, my name is Jenny Jones, and I am the Planning Coordinator for Aging and Long-Term Care of Eastern Washington here in Spokane. So we're going to talk about social isolation and loneliness, just so that we can kind of get a feeling of how they're different and why they're different. My presentation, that's what I'm going to focus on, but I'm going to talk in the sense of rural communities. Over here in Eastern Washington, the majority of the area is rural. So I'm going to try and focus on that a little bit. As you can see on the screen, I have two definitions. The first one is social isolation. And so that's a lack of connectedness with friends and family. And I put on there that ultimately it is a lack of trusting valuable relationships with other people. But I also want you to think about geography and where people are located. And so sometimes it's more of the external factors than the internal factors. Loneliness is a perceived lack of not belonging or connectedness, even though they're surrounded by lots of people and they have tons of friends. They have this feeling of still being lonely. And so I explained it down there at the bottom that where social isolation is more objective, where loneliness is more about their feelings and feeling that way. Folks that have social isolation and loneliness are at a higher risk of having physical and mental health concerns. Next slide, please. On this slide, I really like the information that it represented and the different aspects of social isolation and loneliness that we don't necessarily think of. It can lead to depression, stroke, heart attack, because it raises our hormone levels, our cortisol. It causes sleep disturbances. I'm not going to read all of these specifically. I'm just going to hit on the tidbits of it. But they've been able to prove that folks that are socially isolated or lonely aren't very active. So they end up being complacent. Middle-aged folks that live alone are at a higher risk of heart disease. And then loneliness can also cause chronic stress and strains our immune system. So when you think about that, even during like COVID, even if we were taking care of ourselves, but if we were having issues with the isolation and feeling lonely, it would automatically make our immune system go down and make us more susceptible to COVID or other illnesses that are out there. Next slide, please. This is a really good visual about the different types of what would isolate older adults. I like the information that they have on there, but I also wanted to add that in rural communities, there's a lack of transportation. There's geographical isolation. There's access to technology. And on the other side of that, technology is a barrier. And then there's also communication. Not that there's a lack of it, but that becomes a problem because of geography and where they're located. So in rural communities, there can be an extreme amount of external factors that can create that social isolation and loneliness, even if someone is trying to get connected with resources and groups. But because these communities lack resources like transportation and that services to actually help people and they're located in different areas, but they can't get there. And there's not an option for virtual stuff due to they can't have the internet or they can't have a cell phone. They have to have a landline. So there's just lots of different scenarios that come into play when people live in rural communities. I also wanted to point out another reason why, or some other reasons why people may isolate themselves, older adults, that's not on the screen. One of them was diuretics. When I was a case manager, I was navigating that all the time with my older adults, you know, around their water pills and things like that. And I think it's something that people don't think of. But diuretics, confidence, how that makes someone feel or their self-esteem, mobility, how they are able to move around. I think I already said that, but their self-image. Sometimes there can be career isolation. There's just a lot of variables that just come into this. Next slide, please. So a self-care action plan is always a good place to start. And I want to express this because I was in the mental health field for so long that I think that people assume that they can say, oh, take a warm bath or do yoga or meditate. When the reality is those items might be great for some people, but for most of us, that might not be a way that we want to relax or take care of ourselves. So I think it's important to be open-minded, and a self-care action plan is an individual plan. So when I look at this, what helps me, like the pet, I have 2 dogs. That is so important to me. Like they make my life so much better. And so those other suggestions that I said wouldn't work for me. And if I was a client, it could also be off-putting. So I always tried to start out with my clients that this is about you and what makes your cup full at the end of the day, you know? So that's what I just think is important to think about. I am going to provide Sam a list of resources for the different communities over here in Eastern Washington. And then hopefully she can be able to distribute that to the folks that attended today. Thank you.
Yeah, thank you. And I'll make sure to get those resources onto a slide and post it to the website with the rest of the slides. And next is Tara.
Hi, everyone. Again, my name is Tara, and I'll be talking briefly about how mental and emotional health relate to dementia. If you can go to the next slide, please. Thank you. So the number of people living with dementia is expected to double by 2060. And that's partly good news. It means that we're living longer. But it also means that we all have a part to play in knowing about dementia and being able to respond to it. Next slide, please. So this is my favorite resource for risk factors around dementia. You can see if you go to the next slide, that about 45% of cases of dementia, an estimated 45% of cases could be reduced if we get rid of all of these things. So 3% of cases of dementia could be reduced if depression were eradicated. So one of the biggest risk factors for dementia is depression. And if you go to the next slide, another is social isolation is one of the risk factors later in life for dementia. If you could go to the next slide, please. I'm not going to read all of these warning signs. These are the most common warning signs for dementia, but I do want to highlight the last 3. So decreased or poor judgment can be a warning sign. Same with withdrawal from work or social activities, and then changes in mood and personality. So I don't think we all think of those things as some of the first signs of dementia, but they can be some of the first signs. If you could go to the next slide, please. If you see those signs of dementia in yourself or someone else, the first thing I would recommend doing is going to see a primary care provider. So a primary care provider could do labs, especially the things that I just highlighted could look like dementia, but they could be something else. It could be just a hypothyroidism or medication interactions or a vitamin deficiency. It could be something treatable. So that's the first thing. But also the primary care provider could do a cognitive assessment, which is the first step in diagnosing dementia. You could also get a cognitive assessment from another agency or source. Doesn't have to be a primary care provider. For example, our agency, which is an area agency on aging, offers cognitive assessments. It also is a good idea to visit a mental health professional because some mental illness can also look like those symptoms of dementia we talked about. Getting an early diagnosis also allows you to find resources and plan for the future. If you can go to the next slide, please. It also affects care partners. So close to 60% of unpaid care partners say that their emotional stress is high or very high. And relatedly, about 3/4 of unpaid care partners say that they're somewhat concerned or very concerned about their own health. Additionally, if you go to the next slide, a lot of people, about 1/4 of care partners who are caring for someone with dementia, thank you, are part of the sandwich generation. So caring for both children and older adults. Yeah, you can go to the next slide. Thank you. Here are a few resources that I like that are specific to dementia. So I won't go into these in depth, but Check and Connect is one that we offer, and StarC is great too. So Check and Connect is a volunteer program that we have where we match volunteers with older adults, and they have weekly or monthly calls. And StarC is a program that I really like that offers in-depth assistance with behaviors. And then one more. Some statewide resources that I really like. Yeah, next slide, thank you. Some statewide resources I really like are from the Dementia Action Collaborative. And that their dementia roadmap is really useful, as is the legal planning toolkit. And then Get Set Up is free for all Washingtonians who are older than 55. So I included links to all of those. Thank you so much for having me.
Thank you. And then Sebastian, if you could stop sharing your screen, we will go to Mary Pat.
Thank you, everyone, for joining today. We have heard from incredible presenters, so what I hope to do is to pull it all together. It's important that the area agencies on aging, AARP, and community-based organizations collaborate to provide services, supports, education, and resources. As a senior planner with the Area Agency on Aging for Seattle-King County, we do connect, support, and coordinate services. And that's not just for our clients, but it's for their families, caregivers, the community, as well as healthcare professionals. We can't forget that our healthcare professionals also need to maintain their mental and emotional health. It's important that we realize that social isolation, anxiety, and depression did not go away after the acute phase of the COVID pandemic, as Kathy shared with all of us. And it's really important that we realize we will continue to see COVID and long COVID. And these are the long-lasting impacts on the community's mental and emotional health. For our community dwelling older adults, health and wellness is not what happens in the doctor's office or the hospital. The health and wellness happen in the community. The actions that they take and we take every day. I appreciated what Kathy shared about slowing down the changes in cognition, including eating a balanced diet, getting physical activity. I'd like to share that one of the professors that I used to work with shared a few years ago that sometimes you need to loan people your hope. As professionals, family members, and caregivers, we often are the first line in seeing changes in mental and emotional health. And it's important that we're willing to have that conversation. It's important that we encourage the community, the clients, family, and friends to have someone to talk to. Maybe it's a family member, trusted friend, or maybe it is a mental health professional. Maybe it's the Alzheimer's support group, or the senior center, or the church group. Suzette mentioned Pearls, and this program can be done by visits in the home or via the telephone. Aging and Disability Services also participated in a program with Dr. Patrick Rowie, who is a clinical psychologist and professor in the Department of Psychiatry and Behavioral Sciences at UW. And he is piloting a program called Do More and Feel Better. And this is based on an evidence-based behavioral intervention for depression called behavioral activation. Many clients who have participated in this program reported having less depressive symptoms. They also reported becoming more active, spending more quality time with family and friends, getting more involved with the local senior center, doing pleasurable activities like gardening and helping others. There are ways to stay active and engaged and curious. The important thing is to take the first step. It could be taking a class, virtual, online, or in person, maybe doing a physical activity like Matter of Balance or Sit and Be Fit. And I will be putting some resources for you to review in the chat. And thank you very much.
Thank you. Next, we're going to go to Sebastian for a quick overview of the Walk Cares Fund and how it can help. If you have any questions that you would like the panel, any members of the panel to answer, or Sebastian to answer about the Walk Cares Fund, please enter them into the Q&A function at the bottom of your screen. We will go to the Q&A portion of the webinar right after this.
Awesome. Thank you, Sam. Thank you all panelists for sharing some great information so far. So I'll be brief. I know we're approaching time, but want to make sure we have an overview of what the Walk Cares Fund is. I know several of you from the poll at the beginning mentioned that you are familiar or somewhat familiar with the program, so that's great. So we're going to talk about how the program works and how it will help working Washingtonians. So it is a universal long-term care program in the state of Washington, and it's an earned benefit, which means that you contribute for a certain number of years to qualify for benefits, and we'll cover what that looks like, the three different scenarios here shortly. It's entirely self-funded, excuse me, from worker contributions, and those contributions go into a dedicated trust fund that's used exclusively for this program. Workers contribute 0.58% of every paycheck to Walk Cares. And we can see just as an example, very briefly, what that looks like for a typical worker. So someone who makes just over $50,000 a year contributes $291 each year to the Walk Cares Fund. And you only contribute while you're working. So that means if you retire or if you are unemployed, then contributions are stopped. Just very briefly, what this contributions look like over someone's career. And just to highlight sort of the middle column there, someone who makes about $50,000 a year. We mentioned that they will contribute about $290 each year, but over the course of 30 years, so about someone's career, they will have contributed $8,700 to the Walk Cares Fund. And we see at the bottom there that the full benefit amount of that you can earn is $36,500. That is also adjusted annually for inflation. So I mentioned the contribution pathways. These are the three pathways that folks will may be able to access the benefit. So again, everyone who is contributing to Walk Cares Fund more than 500 hours per year is earning benefits, and that includes part-time workers and temporary workers as well. So by contributing for a certain number of years, you earn access to that $36,500 benefit. So just to go and walk through these three contribution requirements. The first one on the left there is the lifetime access. So this is the pathway that we expect the most Washington workers will use to qualify for benefits. So to use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you access to the full benefit amount, which again is $36,500 adjusted for inflation. The middle pathway there is the early access pathway. So this is going to be for workers who have maybe not yet earned their lifetime access, but have a care need while working or soon after leaving work. So to qualify for this pathway, you need to have contributed for at least 3 out of the last 6 years at the time that you apply for benefits. And this pathway also earns you access to that full benefit amount. And lastly, on the right-hand side there of your screen, we have a special pathway that's just for people near retirement. So this is one of the newer changes that was implemented to the program. So for folks that were born before 1968 and are near retirement as the program begins and unlikely to qualify for that 10-year pathway, you earn 10% of the full benefit amount for each year that you work. So for example, if you worked and contributed for at least 500 hours per year for 3 years, you'd earn 30% of that full benefit amount, which comes out to just under $11,000, which also is adjusted for inflation. So even if you only contribute for 1 year, you can still earn that 10% of the full benefit amount. And near retirees will have permanent access to whatever percentage of the benefit amount that they earn at any time that they need care. And they're also able to qualify through one of the other pathways, of course, if they met and meet those requirements. Moving on here to how we can use the benefits. So once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to the $36,500 budget for services and supports. And that benefit will increase, again, over time with inflation. So Walk Cares allows workers the flexibility and freedom to choose the services and supports that meets their needs. And as we can see on the screen, that can be many different things. So just to share a few examples, that could be in-home or residential care, could be home modifications, grab bars in the bathroom, for example, fall detection, all things that would be included as services and supports within Walk Cares. But Walk Cares is primarily designed to help people age in place in their homes as long as possible. That is what most of us want to do, and most of us can if we have these kinds of supports in place. Walk Cares has many options, again, to provide support for family caregivers. And you can choose someone who would otherwise be caring for you on an unpaid basis to get the training and be paid for the care they're providing, including your spouse. And Walk Cares can help lessen the impact on family caregivers by paying them for the time or making sure that they can get other support services as well. All right, I'm just gonna hop over this slide. This is just an example of how we would, someone would be able to use their benefits, 3 different scenarios. Just to share one example right on the left-hand side there, paying a family caregiver for 10 hours of care a week for 2 years, cost about $31,000, and additionally could purchase care supplies for about $2,000, and that would still be under the full benefit amount. And last slide here before we get to the Q&A is just to share the latest update to the program that has to do with taking your benefits out of state. So the legislature passed this new law allowing people to take their Walk Cares benefit with them if they do move out of the state. So starting in July of 2026, Washington workers can choose to continue participating in the Walk Cares Fund if they move out of state. And to become an out-of-state participant, workers must have contributed to Walk Cares for at least 3 years, again, working at least 500 hours per year, and must also opt in within a year of leaving the state or leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years, and the state is still working on the process for out-of-state participants to report their earnings and pay premiums, of course, trying to make it as easy as possible for participants. And last thing I just want to share about this is that the benefits for out-of-state participants will be available starting in July of 2030. And that is all I have for the Walk Cares Fund. So we'll move on to the Q&A section.
Great, thank you. As I mentioned before, if you have any questions that you would like any panelists or the Walk Cares team to answer, please put them into the Q&A portion at the bottom of your screen. I will go back to some that were answered already in chat. Do any of our panelists have any information about free or low or low cost? If any of our presenters are aware of free or low cost will preparation specifically that be? Yeah, free or low cost services. I know Tara already answered a little in chat. Does anybody else have any information?
What was the question again?
Any free or low cost services?
I
If you
don't,
just-
for specifically what?
If you can, for preparation, I think. It's okay, we can go to the next one. Suzette, if you can tell people how to access your services or get in contact with you for information about the Pearls program.
Absolutely. I did put down on the website, I'm sorry, in the chat, a link to our website for Pearls. I will also put in my contact information and my email. This program is, you don't need a referral from, say, a medical provider or any community provider. You can self-referral. But if you have any questions more about the program, I will leave in my work number and my email, and you can call me directly, and I will be gladly to share with you about our services.
Thank you. And the person just clarified she's looking for free or low cost services for will preparation, like to prepare a will.
Yes. So the Dementia Action Collaborative, this is Kathy McCall from ARP. The Dementia Action Collaborative, and I was just trying to pull up the link on their website. But if you go to their website, there is a Dementia Action Collaborative page, and they have a section on there that is resources for individuals and families. And if you click on that link, there is a dementia legal planning toolkit. And then there's also a link on there for services that you can access that provide legal assistance for free. And I can put the link in the chat. Do the attendees have access to that?
Yeah, or you can send it to me and I can put it in there for you.
Okay.
The next question is about the contribution percent. Sebastian, what is the contribution percent for 2025? Does it change every year?
So the contribution rate is set at 0.58% for all working Washingtonians, and it does not change year by year. It's in the law, so it's 0.58%.
And Sebastian, if a person works 5 years, at least 500 hours per year, would they qualify for 50% of the benefit?
So that percentage amount was for the near retirees pathway. So if you were born before 1968 and had 5 qualifying years, then in that case, and then when you did have a care need, you could access 50% of the full benefit amount. But again, the near retirees pathway was for folks who were born before 1968.
And then is there an option for self-employed workers like freelancers or contract workers?
Yes, there is. So self-employed folks can choose to opt into the program and then have access and earn qualifying years just like Washington workers. But it is something that someone who is self-employed will have to opt into WACARES and pay the contributions.
Great. In the interest of time, I'm going to move on to the next slide, but if you do have any questions, you can continue to enter them into the Q&A, and our customer care team will respond to you through the email that you registered for this webinar with. I just want to close out by thanking you all for attending today's webinar. If you have any questions, as I mentioned, you can enter them into the Q&A portion or contact us directly via email or phone. And today's webinar, the slides and recording will be available on our website at wacaresfund.wa.gov/webinars. And I will add that into the chat. Thank you all for attending today, and we hope to see you next time. We have a webinar on February 19th, WACARES Basics for Near Retirees. Thank you.